I would like to invite on stage Dr. Rakesh Suresh Neby from Sterling Hospital, Pune, to share his views on cancer care in India, its present status and challenge. Please put your hands together for Dr. Rakesh Suresh Neby.
Thank you, Prime Time. It's a great privilege to address this August gathering of health specialists and really a different kind of a forum where I'm discussing cancer, especially in front of people who are trying to use digital technology to improve disease detection and healthcare. While cancer statistics is an oft discussed topic, and we really know that we are having an increasing burden of cancer in the country thanks to the lifestyle, pollution, pesticides and all other things, what can be done to kind of improve the scenario? One is definitely a situation where we need more number of dedicated cancer centers, and we are talking of rural-urban divide. Thankfully, actually, if we really take help of government schemes like one run in Andhra Pradesh, which is really very successful in cancer treatment since 2007. Similar lines, we have one running in Maharashtra. Fortunately, self-sustainable and what you can say economically viable cancer units are possible in rural Maharashtra based on these healthcare government healthcare schemes. However, the same is not possible in metropolitan cities like Pune or Mumbai, where the land cost itself is quite phenomenal. And there is something where we need to think how we can make the land available free of cost to cancer centers, how we can subsidize the machines which are to be put up for, like we need advanced radiation units, which even the taxes run into crores. So whether the government can consider reducing the taxes on these imported machines so that the cancer treatment is available to more and more of the general population at cost which are affordable. We have understood that late diagnosis is one of the bane that affects cancer in our country, and for early diagnostics not only we need to increase awareness, but we need to also remove the stigma of the disease, and the stigma can be removed only by increased survival, and thereby everything seems to be linked. We should focus on primary prevention. We are doing our bit, but still I think a lot needs to be done on tobacco control, which actually kills at least 50% of males, young males, suffering from cancer. We have to look at considering immunization, especially the hepatitis and the cervical cancer vaccines. The other area which we feel we should improve on is clinical research. We are all extrapolating all our data, and all our scientific care is based only on results that are coming from Western countries. We are such a huge population, and we present such a genetic diversity that we ourselves can actually be the guide to the world. But we are not having an environment, we do not have an attitude, we are probably as clinicians bogged down by too much of patient load, where we are not able to generate data. The situation seems to be improving, but still there is a lot to be done. Just to quote data, in 1990 we had around 300 publications which were available in respected journals, and which has increased to 1500. So we have that much increase. Even the citability of our articles have improved. Since the 1990s, which was around 10%, it has increased to 42% citability. But still, the Indian research, to be respected, has to be actually be genuine, and we can focus on areas. We have shown the world in many different areas. Like for example, we have shown the world that simple visual inspection can reduce the risk of oral cancers. Visual inspection of by acetic acid can help in early detection of cervical cancers. We when I was working at Tata Memorial Hospital, we have proved in randomized trials that a breast examination by health workers is actually better or almost equal to mammography in detecting early cancers, and this is where we can give directions to the world. Even if we look at Indian pharma industry, it has made phenomenal difference to the treatment by creating generic molecules which have been used in treatment of patients at much more affordable cost. And this is link the Indian pharma should take it further and actually try to look at newer molecules and give something new to the world. That is what I will have to say on how we can improve cancer care. Thank you very much.
In the category amongst the best oncology surgeon in Pune, the award goes to Dr. Rakesh Suresh Neby.
I'm Dr. Rakesh Neby from Sterling Hospital, Pune. I'm a cancer surgeon. And I am into doing all kinds of complex cancer surgeries, and my aim is to kind of create a institute where we can do charitable cancer work and charitable cancer surgeries free of cost to at least 60% of the patients. I am into cancer surgery since 2001 now, and after my training for 8 years at Tata Memorial Hospital in Mumbai, I have been practicing in the city of Pune since 2007. I have done all complex surgeries. I am involved in chemotherapy care. I am involved in cancer research, and I also invest myself in creating public awareness programs, conduct various marathons for cancer awareness, and also conduct cancer camps for people in the rural areas.
नॉमिनेशन किया गया आपका, कैसा लग रहा है?
Abhi, actually it's a very good feeling that my work is getting recognized, and it would definitely inspire me to work more in this direction, and maybe this will also help me to reach out to people where people can come in and help me to set up a 100-bedded charitable cancer center, which I am intending to do in the periphery of Pune.
जो सर इस क्षेत्र में दूसरे डॉक्टर काम कर रहे हैं, उनके लिए आप क्या कहना चाहेंगे? कैसे काम करना चाहिए आगे बढ़कर?
As far as today's practice is concerned, I feel that each of us should collaborate with each other so that we share knowledge and kind of share our experiences so that patient gets the best possible care. Now we should also be trying to coordinate and correlate so that if the patient happens to come across with different doctors, we should be speaking in one voice, sticking to the scientific guidelines so that it does not, it avoids misunderstandings with the patients, and the patient also gets the best care.